Kia ora tātou. It's my pleasure to introduce our next speaker, a person who has made an indelible contribution to our society, and we look forward to hearing her. Merepeka was born and educated in Fielding in the Manawatu. She lives in Rotorua, her mother's tribal area. Merepeka's early career was spent living and working in Switzerland. Her MBA is in International Management. Merepeka has worked as the CEO of the National Collective of Women's Refuge, CEO of West Auckland Hospice, and BOP Area Manager for IDEA Services. An elected member of both the Rotorua District Council and the Lakes District Health Board, she is Deputy Chairperson of the Te Arawa Whanu Ora Regional Leadership Group. Merepeka is also a member of the Māori Reference Group, working to develop actions to address and eliminate family violence. She believes that Whanu Ora is a philosophy whose time has come. She believes Whanu Ora is all about whānau realising they have unlimited potential and being in control of their own lives. I'm reminded, ladies and gentlemen, that in 1988, termed the Great Communicator, President Reagan was in Berlin, and there, in front of the Berlin Wall and in front of the Brandenburg Gate, this great communicator said, "Mr. Gorbachev, tear down this wall." Today, we have a great communicator. Interviewed on TV some time ago, when she was CEO of the National Collective of Refugees, when asked what the solution to this domestic violence was, she said, simply, "Māori men, stop beating your partner. Stop abusing your children." Ladies and gentlemen, I present Merepeka Raukawa-Tait. Tēnā koe hene, nau mai, haere mai, tēnei te mihi ki a koe, kia ora.
Nā mihi kia koutou, nō nā hau e whā, tēnā koutou, tēnā tātou katoa. I actually think my message has softened somewhat in the last 10 years, Bill, because you do want to make sure that the message is getting heard. But can I say I'm actually delighted to be with you this afternoon, and I'm probably delighted because I'm one of your final speakers of your conference. So you would have heard so much, you would have seen so many graphs and statistics put up on the board and on the overhead, and I'm not going to do any of that this afternoon in terms of overheads. I just want to stand and deliver and have a conversation with you. I do want to talk to you about Whanu Ora, because I believe it is a philosophy whose time has come. And there is quite some confusion in New Zealand about what Whanu Ora actually is. So I would like to talk about Whanu Ora, but I also feel it's important that we talk about what is happening in New Zealand today. And in your work, where you make such a difference, I'm sure you have an awareness, but I think I would just like to start my presentation this afternoon in talking to you about some of the things that are happening in New Zealand that are making it quite unsettling for the people you have and see every day, and for many throughout our community. But first, may I please thank you for the work that you do. Oftentimes, we get up every morning, we do the work that we have to do, we've got family issues, we've got other things happening, and we very rarely pat ourselves on the back. In the work that you do, you're making a difference in this country. You're making a difference in the lives, the quality of lives of fellow New Zealanders, and I want to thank you for that. I want to thank you for attending this conference where you've had the time to get connected with others, not only in your own sector, but other people who have come in as guest speakers, other people who have welcomed you here to Te Arawa. It's important. It's important that we share information, that we know what's going on in another person's area of work, that we also get an understanding of another person's worldview. So I'm pleased that you've taken the time out and to come to your conference, and also I just want to thank you personally for the work that you do back home. Many of you have left other parts of New Zealand to go to work in other parts of this country. Many of you, I'm sure, are from overseas as well. So you've had to establish new relationships, you've had to, not only new relationships, but in communities, you've had to get to know your community. And without getting to know people, it's very hard to actually add value to their lives. So again, I thank you for the work that you do. And I'm saying it right now because often I mean to do it at the end and I actually forget. And that's important, that you need to be acknowledged for the work that you do right now. These are definitely changing times in our country, changing times throughout the world. But it's only a little over 2 years ago that we had Pike River, that we have had the Christchurch earthquake, that we've had the Rena disaster out here in our harbour in Tauranga in the Bay of Plenty here. We've had the PSA that's decimated our kiwi fruit industry. We've got the benefit reforms taking place. We've had the global financial crisis. We've got local government reforms taking place. We do right now have the regionalisation of our health boards. And in the Midland area, where I'm on the Lakes District Health Board, we've got 5 district health boards. So we've got the regionalisation of our health boards taking place, the reform of the RMA, and in amongst all of that, every part that I've just spoken about, every one of those parts, has had an impact on our country, on our families, and on our communities. And so while we may have had some issues further back than the last 2 years that this country has had to grapple with, and indeed we have, a lot of what I've just said has added to the mix. It's added to people's uncertainty, it's added to their stress levels, it's added to their anxiety as to their ability to hold themselves and their families above water. And so that's only in the last couple of years that we've had all of that going on. And it does make for uncertain times. And when you've got families who are not coping, and you've probably heard in the last 24 hours, we've got another 150 people who are going to be made redundant in this country. And for every person that is made redundant, 6 other people are impacted on that. So it's large. And the issues that are confronting New Zealand are actually very, very severe at this point in time. But added to that mix, you have families that have not coped, and have not coped for many, many years. And so this is just another lay or overlay onto their current situation. So the environment in which we are trying to do our work, where we are trying to make sure that we're adding value in our work, we are trying to assist the families, that has all changed. And of course, the social issues in this country are what tends to be consuming most of our time at present. There has been the spend, and you've heard some of the speakers, and I was able to sit in and listen to some of them, but you have heard the spend in the social service area is actually quite crippling for New Zealand. And yet most of it, over time, could be actually greatly lessened if we could make some improvements in terms of social, economic, cultural, and environmental well-being. And that's really, when we talk about Whanu Ora, that's actually what we're talking about. We're talking about families who are able to live to their potential. That's what Whanu Ora, it's quite simple. People get all complicated about Whanu Ora, and they often say to me, oh, but we've been doing Whanu Ora for yonks, for years. If they had have been doing Whanu Ora for many years, then we would not have the problems that we have today. But Whanu Ora really is about families living to their potential. And I believe it could be the circuit breaker for many of the social issues that we have in this country. Whanu Ora came about as an initiative by the Māori Party, and let there be no mistake that when Tariana Turia walked and established the Māori Party, she said that she was there only and primarily for the interests of Māori. Māori had not been well served in the past, and she wanted to enter Parliament and make a difference. When she couldn't within the Labour Party, she stepped aside. I thought that took great courage, absolute courage, to say that I am going to step aside because I want to go down a certain path, and that path means making improvements for Māori. If it cannot be done within a mainstream political party, I will start my own. And indeed she did. I think she's the most courageous and brave woman. So when she did decide she would enter, obviously, and she wanted to make a difference, and so much money has gone into a big black hole in terms of the social services spend in this country, social welfare spend in this country. And we, as the taxpayer, there's been very, very little in the way of improvements in many areas, and we have not said anything about it. We've just allowed our tax dollar to be continuously poured into a big black hole and without any real gains. And of course, as you know, Māori are substantial recipients of the social welfare spend in this country. And so Tariana said things have to change. And that's what she asked of the national government. If you want my support and the support of the Māori Party, this is one of the initiatives that I want funded, and it is Whanu Ora. And Whanu Ora is, as I said, it is a philosophy, it is not a program, it is not an activity, it is a philosophy of Māori living to their potential. Personally, it should be for everyone. Everyone living to their potential adds great value, not only to their whānau, their hapu, their iwi, but to the country as a whole. And everybody living to their potential means that they are strong socially, economically, culturally, and environmentally. They are strong, they are well connected, they know who they are, they know that they can achieve whatever it is they put their mind to. And that's what she asked of a number of us, to look at the potential from Whanu Ora and to see what we could do to assist the successful implementation of Whanu Ora. Because what we'd had in the past was not doing any good, and it would not improve the situation for Māori in the future. So we've had to have a very, I suppose you could say, absolutely honest look as to see what is the situation in New Zealand. And you would have heard some of that presented this morning by Henare O'Keefe. I wasn't here, I know I know the content of Henry's speech, and I was able to spend some time with him last night. We don't see each other very often these days, but I'm very, very aware of Henry's work and what he would have wanted to share with you this morning. I was also present for Johan's speech, or delivery just before lunch, where he highlighted what needs to be done in making sure that children born pre-birth and born and are able to live to their potential. And that's what, with Whanu Ora, we're hoping to achieve. So right throughout the country, there are 300 providers who have got together under 30 collectives, 30 collectives, and they are looking at a new way of working together. They're looking at a whole of whānau approach to assisting that whānau to get better outcomes. And that just isn't. We always talk about, well, it's the health, and it is the health outcomes that we want. But it's not just coming from health alone. It is education. It is labour force participation. It is being culturally strong. And so the providers who were identified as having the potential to make a change have been formed into collectives and are having to work together now to look at the whole of whānau, to look at what is happening in that whānau. It's not much good saying that when someone presents or someone has an issue in the whānau of truancy, and then you go to that home and say, well, your children aren't coming to school, and you can be prosecuted. When in fact, every 2 weeks, one of the students in the home is having to stay home while the mother has to travel to Hamilton or wherever for oncology treatment or for chemotherapy treatment. So when you start to look below the surface, you see that there are a whole range of issues that are actually affecting that family, and it is never actually what it seems. And so when you take a whole of whānau approach, you will know that there's no income coming into that home, or very little in the way of income. You will find that there's probably truancy, alcohol and drug abuse. There could be violence in the home. And so if you're only going to pick off a certain piece, just a part of the problems in that family, and try to address that, you will get no long-term benefit, or there'll be no long-term benefit to the family because you're not addressing it as a whole. And so Whanu Ora has identified the providers who have the credibility and standing in the community who can make that first, or have even now, that first engagement with whānau. And they can sit beside them and peel away the layers and get to the root problem. And of course, if you're going to do that, you're going to have to get people who have perhaps in the past never worked with each other before. These are social service providers who have never worked with each other before. Sometimes they don't particularly like each other. because there is quite a lot of patch protection. It goes on. I don't know if it goes on in your area of work, possibly not, but it does actually for some providers, because a lot of them chase the same dollar for their contracts. A lot of them have worked very hard over the years, and the thought of having to now work together with somebody else to provide the full range of services can in fact be quite threatening to them. People want to work autonomously, and they should be able to do that, but you have to now put aside what it is that you want and actually focus on what is it that we want to achieve long term for this whānau. And so that has been quite challenging for the providers. It has been quite challenging for some of the people who have in the past always seen themselves as being, how would you say, the primary advisor or first point of call for support for that family. But providers have had to look at how they're going to work differently. What Tariana has asked everyone is, if you have anything to do with the well-being of families in terms of education, health, labour force participation, housing, a big one as well, housing, review the services that you provide. What are you actually providing? How well are you doing it? But more importantly, has it made a difference? And for many people, actually it hasn't. We continue to do what we've always done over many years, and actually nothing ever changes. And so with Whanu Ora now, there are some contracts that may well go. And there are some contracts that have been and have been with providers of services for many years. Some of those service providers are well known to us, and yet what has actually changed? And we should never be afraid of reviewing or evaluating the current programs that are out there and the activities that are being undertaken, because if nothing has changed, then they should no longer be funded by taxpayers' dollars. And what has happened through Whanu Ora now, we are trying to say to the whānau that you have an absolute right to be assisted in the way that you want for the short period of time that you need it. And the services have to be whānau focused, and we have to ensure that they're actually getting what it is they need. We need to say to whānau that no matter what is happening to you right now, that is no determinant of where you will be in the future. And that's what we always tend to say is, well, you've presented with this and this problem. And so we get so bogged down on the problem without telling them about their potential. And Whanu Ora is about asking families to look into the future to see what would a desirable future for you look like. That's one of the wonderful things. When you sit down with whānau and say to them, what is it that you would like in the future, in 5 years' time? Because wherever you and I and that whānau are going to be in 5 years' time, that actually starts now. The planning for that starts now. You and I know that. But for whānau, when they're overwhelmed, when there's little money coming into the house, where there's violence, abuse, somebody's away inside and all of that, then it's very, very difficult sometimes for them to think, well, hey, this is probably as good as it gets. And I've had 2 families say to me, Merepeka, we're too far gone. There's no hope for us. There is absolutely hope. There is absolutely hope for whānau when you put in the right support at the right time. And that means you need the right people. That means you need the right people assisting those whānau. And you need the right people sitting down with them and saying, listen, there is another future. If you don't know what that might look like, let's put the whiteboard up, or let's put a blank paper up. I have not yet, over all of my years of working in the community and working with people up and down this country, I have not yet met one whānau, apart from those 2, who have not said, I love my children, I want the best for my children. You heard Johan say that today. Even people who are going through the most extreme hardship, they know that they want a better life for their children. The koros and the nannies want a better life for their mokopuna. So how can we, who have resources, who have the education and training and the expertise and the knowledge, how can we make sure that their dreams are absolutely realised? You and I follow our dreams every day. We live and work and spend time with people that we love. So we want to make sure that all families in this country, Whanu Ora wants to make sure that all families in this country have the opportunity to do that as well. So what the Whanu Ora providers do is they sit down with the whānau. And some of those whānau are now self-referring. Some of those whānau are being referred from other agencies, and some of them will just come along and say, can I have some information? And there it leads to them being put in touch with a provider. And that provider just sits down with them, and it can be very revealing as to what you do here that's going on in that family. Whānau Ora it's come in for some criticism recently because people say, oh, well, it usually just tends to be a gathering of whānau, sort of like a family reunion or a gathering of the clans, gathering of certain iwi and certain whānau. Of course it has to be. You are a member of a whānau, you are a member of a hapu, and if you've got certain and significant issues going down, who will be able to influence that whānau? The GP? I think not. Possibly. The headmaster at the school? Possibly. But the ones who will be able to challenge that whānau in terms of there need to be some new behaviours commenced or there need to be some behaviours stopped will be other members of that whānau. Usually those members will be older ones, and hopefully they will be taking a leadership role in that regard. But when I hear people saying, oh, well, it's all together, it's just about whānau getting together and having a nice reunion or something. No, it's about whānau having to once in their lives possibly confront the realities of the situation for some of their whānau members. And that is not easy. And oftentimes it can't be done in one meeting. And sometimes the most significant person to influence that whānau is situated in Invercargill rather than in Nelson. So there has to be some means of getting that person who can influence that family to that hui to say, right, we share whakapapa. We share whakapapa. When anything happens to this mokapuna, this is my whakapapa that you're beating up on. This is our tūpuna that you're beating up on. And so some of those harsh messages do need to be given. But there are good people who are working in this area to sit beside those families and see what it is that they need in the way of support, encouragement and guidance, and who is best to give that to them. It is a wraparound service. It is a wraparound service. It is the whole of whānau. Everybody living in that whānau. You need to look at what is happening for every single member and how can you provide those services. You and I know that in the past, if you had a Ministry of Health contract or a Child, Youth and Family contract, then you only dealt with the child. And so you may be able to support the child and help the child over for a short period of time, and then it goes back into that same toxic environment from whence it has come. And so nothing absolutely changes for that whānau and for that child. And so you have to make sure that you're looking at everything that's happening, the dynamics and everything that is happening within that whānau. And then, of course, nothing's going to happen without some resources to be put into assisting that whānau to move to where they want to go. It has to be a planned approach. If you're going to assist anybody into the future, and particularly families that are very vulnerable, it can't be hit and miss. So you need to sit down with them and you need to plan it all out, and you just need to stage it, and you need to see the things that can be realised within a short time. People say to me, now Whānau Ora's now 2 years old, Merepeka, we should be seeing marvellous things happening. Well, some of the issues that you will see in those families have been there for many, many years. Oftentimes they're learnt behaviours and they've been practised over many, many years, and they're not going to go away overnight. There is some support that can be offered and can be taken up virtually immediately. But if you're planning for a future to change and have a whole different look in 5 to 8 years, then that's going to take quite some time actually to formulate and to gain the resources and the support to put it in place for it to be successful. So Whānau Ora, yes, there will be programs and there will be activities, but it is a philosophy about every individual must have the opportunity and the right to develop to their full potential. I have seen families who are starting now, I have seen members of the family starting to emerge as the leaders of that family. And they are no longer the older ones. They are the ones that know what's at stake. They can be the young mother that's sitting quietly in the corner and has very rarely said anything but knows what's at stake if nothing changes for her whānau. So those are the wonderful things that can happen. It also is challenging for some of the providers with the services that they have been providing over the years. Family are now saying that's not what we want. And because, as most of you know, in the past it was, here are the range of services and activities that we offer, this is what you've got to have. And families are saying, no, this is not what I've got to have. This is not what I want. From my plan, these are the things that I need. And so families are becoming more assertive in what it is that they want. They know that they have an opportunity now through Whanu Ora to take a planned approach to their future. They know where the support is going to come from. They know that support will be there to stay with them along their journey. And they will know at the appropriate time, when it is time to tell those people to say, well, you can butt out now. I'm very strong, I'm resilient, I can sustain this program for my family, myself. And surely that should be the ideal. So around the country now, everybody is mobilising. I'm sure that you have heard in your areas, you've had people come to talk to you about Whanu Ora. I do hope that you know who the providers are of those services. And you should. And you should be able to, if you feel you need some support from a Whanu Ora provider, you should be able to get in contact with that provider. If they can't support you, someone in their collective can. They can give you the information that you need. It is actually important that you do know who these people are. Otherwise, you may well continue, if you do, to refer particularly Māori clients and Māori patients to providers where the outcomes are going to be the same as they've always been. So there will be a lot more activity in the Whanu Ora space over the next few years. And hopefully it will inform eventually the way social services should be provided in this country. You may not know, but Whanu Ora is not exclusively for Māori. Whanu Ora is there for everyone. Why should a Māori family be looked at in its entirety and the other family that comes in, who is not Māori, just have this little part of their concern or their issue looked at? Why shouldn't they be given the opportunity to develop to their full potential, knowing that if this is an area for housing, it'll be looked at, but if this is an area of my health, then that will be looked at as well. You have to start looking at that. You have to start looking at the individual as being part of a whole whānau. We heard from Johan this morning about the vulnerable children's, the white paper obviously, and the vulnerable children's demonstration site that is here, taking place here in Rotorua and in Whangarei. And it's always, to me, seems rather strange that we talk about vulnerable children, because if there's a vulnerable child, you can bet your boots there's a vulnerable family as well. Children don't live in isolation. Children live as part of a whānau and a part of a family. And so the vulnerable child is living in a vulnerable family. Those families usually are very easy to identify, but we are reluctant. We seem to be reluctant to say, these are the issues that need to be addressed. I can't do it. I've seen you in my practice. I've seen you in the medical centre, but I can tell you where I think you could get some support for your current situation. I believe and I sincerely hope that Whanu Ora will be successful. It isn't just around the provision of social services. It's about making sure that the people, the whānau, do have the income to do the things that they want, that they are socially, economically, environmentally, and definitely underpinned by the cultural strength as well, that all of those things are working together to make them strong and resilient. A strong and resilient whānau has a wonderful contribution to make, not only to their hapu and to their iwi, but to the whole of the nation. It is the right of every individual New Zealander to make a contribution to the ongoing development of this country. There should never be just an A team and a B team. There should never be the haves and the have-nots. Those of us who are educated and who are well-heeled, we know our place in this society. For others, they've never, through a whole range of circumstances, many not of their own choosing, have not got a foot on the bottom rung of the ladder. Just before lunch, I heard Johan talk about some of the things, and a lot of it was around poor government policy. A lot of it was around poor government policy. We tinker with everything. We tinker with things. We are reluctant to challenge poor leadership. We are reluctant to say to this government, how is it, or to any government, successive governments over the last 50 years, why is it that we have a high tolerance to the abuse of children and women in this country? And let me make it very clear that the abuse to women and children isn't only occurring by our men. It has now spread to where we have women and mothers who are actually getting quite a dab hand at abusing their children as well. And that is not to be tolerated. But we don't challenge the leaders of government departments to put in place better policy. The same old, same old. I can look at a piece of policy and know straight away it's not going to be workable. It's not going to be implemented successfully. So who is developing this policy? And how are we developing policy in isolation from the communities in which we hope it will be successful? Why do we continue to develop policies where there has been no input from the very end service user that we're hoping where it will make a difference? But we continue to do that, and actually, as I said, we continue to get the same old, same old. So people do need to live to their potential. They do have to be given every opportunity to do so. Excuse me. So as what we have said is for everyone who is working in the area of a whole raft of areas, what can you do, what are you doing, how well are you doing it, and has it made a difference? In New Zealand, we talk always about the government and the public sector doing as best they can, and we look at the successes of the private sector, and oftentimes we overlook the value of the NGO sector. I was in Auckland this week and I attended a meeting where most of the people there represented the unregulated workforce in the health sector. These are the community workers, the support workers. I understand even the orderlies in the hospitals, it's part of what they call the unregulated health sector workforce. And of course, when you listen to the work that they do, and oftentimes they're the first point of engagement for the families that you see and that I see and others work with. And when you see the range of skills that those frontline workers have, and there'll be some of you here today, I'm sure, but when you see the range of skills that they have, their ability to cross cultural lines, their ability to see the world from the view of the person sitting in front of them or alongside of them, their ability to communicate in a way that will not cause the person to be anxious about what you might hear in your role. They have wonderful, wonderful skills, but they feel undervalued. They feel undervalued in what it is that they can do to get alongside the regulated or the professional people, or those with the professions who work in the health sector. They want to be able to get along and have that connectedness and that closeness with those who are working in that regulated area of the health service. And that's part of getting together, and it's getting connected as well. Because if you don't, one will have a view of how things should be done, and the other actually knows the reality of when things do happen and when we have to take some immediate action. So there is a lot that can be done, and there is a lot where we can start to make a difference. I do want to just say that I do believe that we do not have courageous leadership in our country. We do not have, even within our whānau, even within our, well, you'll all know about the iwi leaders group. They're up and down the country right now, and they're looking at water. Yes, well, whoop-de-doo, we know water's important. But let's get back to basics and let's make sure that the family receives the attention it needs. Everybody's running around with treaty settlements. Yes, well, whoop-de-doo. We know they're important. But who are you doing it for if you don't do it for the families? Who are you doing it for if you're not doing it and concentrating and focusing some effort on the vulnerable children and the vulnerable families? Who are you doing it for if not all boats and all people are starting to rise? And so that is my concern, and that's my concern when leadership seems to think, well, the development of our economic assets are of greater importance than the development of your most important resource, which is your human resource, your whānau, your hapu, and your iwi, the people who should be the most important part. We can all grow our assets, but if you do not grow the people, there is that imbalance, and over a great period of time, and it's already happening now, the people end up by costing you absolutely far more at the end of the day. So I would like to think that we have courageous leadership. I want to see more courageous Māori leadership. There are good people who have been speaking up for a long time, but they are normally a voice quietly rattling away in the wilderness. And that can no longer be tolerated. So we must make sure that all those who do speak out are heard, We must provide a forum for them, and I do thank you for the opportunity to speak at your conference, but we do have to provide a forum for them to speak so that they can say, these are the realities and these are the things that we can do. We have to challenge the government. When the government decides that, well, we're going to sell off our assets, and I heard the Prime Minister here the other day in Rotorua saying we're going to sell off our assets and we're going to buy some more. Well, I wasn't quite sure which other ones he was talking about. There's damn few left, I think. But however, there must be some more that he's going to provide. And you and I know that the most people who I'm talking about today, they'll never have the $1,000. I understand that it's going to be, whatever a unit is, it's going to be at least $1,000. They'll never have $1,000 to buy one unit of what they already thought they owned. But who knows, who knows? But we should challenge. We should challenge and just make sure that whenever we see something that is not going to support and uplift families, whether vulnerable enough or not, we should have the courage to say, this is not good, and I think you should have a relook at it. And when you see something in your own areas of work, then you should also, I believe, have the courage to say, I think we can do better, I know we need to make some changes, and this is my suggestion as to making change. We all have that obligation. We all want to ensure that everybody knows that we are an inclusive society, that we can no longer tolerate and should no longer tolerate and support those who will continue to always have more. The gap is widening. The gap is widening. New Zealand is a wonderful country. I believe that we have resources to go around. I believe even in this room today, there is enough intelligence, there is enough commitment to actually say that we can make a change and we can make a difference. And I do know that a lot of your speakers have already indicated through their addresses where some of that change can be made. But it does take courage, and it does mean that I believe there could be this tsunami of change taking place in this country to say, we want it better. We want it for everybody. There is not the dollar around that it used to be in terms of the government coffers. The income tax take is down, the GST take is down because people are not spending as they used to. So that means social services will be spent. And I'd like to think that over time we can reduce social service spending because we've made a difference in all of these areas. So it isn't just in health, it is in housing, it is in education, it's in all of those areas that we can make a difference. So when we talk about Whanu Ora, it isn't just in health, but it is people living to their potential in all areas that they see fit. The providers throughout the country are committed to doing what they can and to make that difference, to sit alongside of families, to support them in their planning process, to make sure that if there are resources, that those resources will be redirected and will come their way, and to support them to make the quantum leap that many of those families have made, will need to make. I just want to say that I know that here on your first day of your conference, the Member of Parliament for Te Waiariki, Te Ururoa Flavel, was here, and he did ask me, he knew I was coming today, and asked me if I could bring you some information. There are some books up here, and it's on the health of rural Māori. It's very, very current. It's only last year's. It's just really come out, and please do take one. I didn't want to tell you the situation of rural Māori. You know that already, and because many of you work in those areas. But if there is a difference going to be made, actually, you will be part of that difference. You will be part of the people that make a major difference to your patients and your clients, and to the people that you see in the rural communities. You do have the support of providers up and down the country. You do have the support, particularly I have to say, of Tariana Turia, because I'm sure from time to time she has been a speaker at some of the functions and some of the conferences that you have attended. She knows where people can make the difference. She knows who can make that difference, and she believes that you're part of that as well. I'm definitely not here to trumpet the Māori Party, but I am saying that Whānau Ora was given birth through the Māori Party, and actually we know what's at stake, and we know that things can be better, and we know that if families are well, fully contributing to New Zealand society, everyone in this country benefits, and that must surely be the aim. I thank you very much for the opportunity to be with you this afternoon. Tēnā koutou, tēnā koutou, tēnā tātou katoa. Kia ora.